Monkeypox, what should we know about the new health emergency? Hello everyone and welcome. Today we are going to address a topic that is causing a lot of discussion, the recent epidemic of monkeypox in the Democratic Republic of Congo, which prompted the World Health Organization to declare a public health emergency of international concern. But what does it really mean? Should we expect a new pandemic similar to COVID-19? Pandemic? No, but it is important to be informed. Before getting into the heart of the matter, a small parenthesis: if you like the content and want to stay updated, subscribe to the channel. It is free for you, but for us it makes a huge difference. Thank you so much. Current situation in Africa. Since the beginning of 2024, the Democratic Republic of the Congo has seen a worrying increase of over 15,000 clinically compatible cases of monkeypox and more than 500 deaths. What really raised the alarm was the appearance of a new strain of the virus, Clade 1b, in 4 African countries that had never recorded cases before: Burundi, Rwanda, Uganda, and Kenya. This new strain appears to be more aggressive than Clade 2, which was responsible for the 2022 and 2023 epidemics. The virus has already reached Europe, with a first case detected in Sweden on August 15, 2024, followed by a second case in Spain on August 19. Despite this, experts emphasize that we are not facing a new pandemic. However, the European Centre for Disease Prevention and Control, ECDC, has recommended strengthening prevention measures to avoid further spread. To better understand the situation, we report excerpts from the interview given by Nicolò Binello, who is official and expert in infectious diseases and tropical medicine. Nicolò explained to us that, despite the emergency declaration, monkeypox is well known and manageable. The declaration of a public health emergency of international concern is a precautionary measure, explains Binello. It does not necessarily mean that we are facing an imminent pandemic. Unlike COVID-19, monkeypox virus is transmitted primarily through direct contact with skin lesions or mucous membranes of an infected person, rather than through the air. This means that the risk of a massive spread is much lower than with COVID-19, provided that appropriate control measures are implemented. According to Binello, the primary transmission mechanism for monkeypox is through close contact, often during sexual activity, with an infected person. It is also possible to contract the virus through contact with contaminated objects, such as linens or towels, or through exposure to bodily fluids of infected animals. Although the virus can be transmitted through the respiratory route, continues Binello, this mode of transmission does not appear to be the main cause of large-scale spread. In the interview, Nicolò talks about the differences in prevention methods between monkeypox and COVID-19. While COVID-19 requires complex public health measures, such as social distancing and the use of masks, prevention of monkeypox is much more focused on avoiding close contact with infected people or contaminated surfaces. The good news, says Binello, is that we have extremely effective monkeypox vaccines that were derived from historical smallpox vaccines. These vaccines are especially indicated for people at risk, such as close contacts of confirmed cases, healthcare workers, and people with multiple sexual partners. However, adds Binello, mass vaccination is not recommended at this time. However, it is essential to vaccinate people at risk, pregnant women, children, immunocompromised people, to interrupt the chain of transmission and prevent serious disease. In light of all this, it is clear that, despite the alert, we are not facing a health crisis of pandemic proportions. As Nicolò Binello pointed out, we already have all the tools necessary to contain the epidemic. Therefore, while not underestimating the situation, there is no need to be overly alarmed. We thank the expert Nicolò Binello from whom we took the reported news. If you liked the video, don't forget to subscribe to the channel, leave a like, with a comment, to let me know what you think. See you soon.